Health experts define it as delays in communication or social skills and repetitive behaviors. But to families, it may just look like behavioral differences.
Children with autism generally don't point. They generally don't pretend play, like feed a baby doll or pretend that they're cooking. So when we don't have pretend play and we don't have pointing, and then there's also a lack of words, we get concerned that we might have autism.
The American Academy of Pediatrics recommends all children be screened for autism at 18 months and 24 months.
When we identify children early with autism, they can start receiving the services they need, including speech therapy, behavior therapy, occupational therapy, and those therapies can help kids make a whole lot of gains.
Lee Health offers children a free and private screening to help determine their risk for autism.
And the one thing about the screening here is it's private and there are no strings attached. Nobody gets the report except the mom or dad, whoever brings the child. We don't even take insurance information. We just, sit down and have a discussion and do the screening, and the parents go home and do with it what they wish.
If health experts suspect a child has autism, they can help families get the care they need. For Lee Health, I'm Lindsay Morton.